Hi, my name is Raul Sansores. This is my wife, Anna Sansores. I've been sober for a little bit over a year, 375 days to be exact.
Hi, my name's Trent and
Natalie Cohen.
I count my sobriety date as May the 30th, 2020. I did start AA in 2017 and I achieved a number of periods of sobriety of about 9 months. I would then go out for an evening, drink, come back with my tail between my legs, start all over again.
Every patient has a story about how they found their way to UCLA. Can you tell us about your first interaction with UCLA and the events leading up to your liver transplant evaluation?
By the time I got to UCLA, I'd been transferred from another hospital. I'd been very, very sick. I had double pneumonia. I was bleeding out of my neck profusely and receiving a lot of blood and plasma transfusions. When I got to UCLA, I knew in myself that I was dying, but I hadn't been told it. I had a nurse come up to me, this was my first interaction, and she took 3 hours to brush my matted hair straight instead of shaving it off. And it was a Sunday afternoon. She put on some nice music that I like to listen to, and I felt very comfortable. And when she was doing this, she said to me that my liver wasn't going to get better and that I needed a transplant. And I felt an immense amount of relief because I finally was being told the truth that I knew very much inside of myself.
My first interaction with UCLA was about a month and a half after being hospitalized in my regional hospital, where I was given the diagnosis of an end-stage liver disease. At that point, all they could do was medically treat me and send me back home. A liver transplant was my only hope, but they couldn't provide that for me. Then I was transferred over to UCLA middle of July, and at that point, when I came, I was given the positive news that liver transplant was possible. Immediately when I came to UCLA, the experience was completely different. I saw immediate action and I saw a glimmer of hope that transplant was going to be possible and that possibly I could live past my 5-month diagnosis of survival.
Sometimes people think that getting a liver transplant is the magic fix, but working on your recovery and maintaining that is a whole other thing to focus on. Can you tell us a little bit about that?
My mind shifted towards recovery stronger when I first got my diagnosis, because at that point I still thought that there was a possibility of me fixing it myself by drinking more cranberry juice, for example, or more kale. But my body was really giving up on me, and I had to realize that I couldn't fix it myself. After transplant, what's keeping me in recovery is a shift in my mindset. I was given a huge blessing with this transplant, and I feel a huge responsibility to pay it back, pay it forward, do something with this miracle. Keeping me in recovery is my family, mainly, that supported me through the whole process. The new job that I have, for example, which is a lot of community work and a lot of positive work that I do with other people. What's keeping me in recovery is the Alcoholics Anonymous group that I have, which I participate 3, 4, sometimes 5 meetings a week, and I actively participate as a secretary in the group. So more involvement is keeping me in recovery. The realization that I got a gift, like I mentioned, the honor that I was given, and the thought that a lot of people sacrificed their time and their energy for me, and somebody actually had to pay their life for me. That's a huge cross to bear. Specifically, my recovery programs are Alcoholics Anonymous, the therapist, and the extra work that I do to keep myself active, to keep myself, hold myself responsible to the gift that I was given. And with my therapist that calls me every week, I give her all details, and I'm completely open and honest, and I've been surrendering myself to the program and everything that they tell me to do, and how they suggest I should live my life.
Because there was no more running, I was out of self-pity. I just felt horribly that I was going to leave this beautiful lady behind, my brother, my father, my sisters, but That's when it changed. And I tried before with Alcoholics Anonymous and working steps and trying to be sober. And something, I went to meetings every day, but something wasn't clicking, that fundamental thing. And I spent a lot of words, as you can tell, I'm good at talking. I did a lot of talking, a lot of words, and it was just a very simple thing. I let go. I had no power over the situation. So when I got to UCLA, I already felt unburdened by that. And then I spoke to my social worker who was interviewing me about, what are you going to do if we try to save you? How will you stay sober? And I was out of bullshit. I just had to say, there's nothing I can say that will prove this to you. But if I get a chance to live, I'm going to try and live the best that I can. With a grateful heart, and just be humble and do the best that I can. With regard to recovery programs that I continue with, I still am an active member of AA. I go to multiple meetings, not just one, different formats. I participate as well in the UCLA liver and small bowel transplant group, which is a different family. It's a different community. It is definitely a family, a different kind of understanding that takes place, because we're not just promising on a spiritual and ideological level. It now has a medical necessity too, that I take very, very, very seriously. I'm only here because I've been blessed with this through UCLA, through a medical facility. So I have to uphold my end of the bargain, absolutely every day. Sobriety is an everyday issue that you never are going to own. So every day you've got to pay rent on it. And then also I have an addiction therapist. I speak to him weekly. Every time I speak to him, it feels like a 15-pound weight has been lifted off my chest.
A lot of people who are starting to work with the program at UCLA are looking for some really sound advice. What better place to start than from the firsthand experience?
If I could give advice to somebody that's working on their recovery, is to seek out those therapists and those programs that are available to you and do what they say. Specifically for me, I sought out Alcoholics Anonymous, and I wholeheartedly surrendered to the program. I follow all their directions, and I've gotten myself a sponsor, which is very important. Following the steps in AA are very important. Surrendering yourself to your therapist and what your therapist tells you to do is very important. Honoring your wife and your family and your kids is very important. And if you think about everything that you've missed out, this is a kind of treatment to try to make up for everything that you didn't do or that you did wrong.
We need to love ourselves in a more complete way, an honest way, which means taking care of ourselves. You gotta eat right. You've got to follow all of the nutritional demands that your doctors are gonna ask you to do, whether you're pre-transplant or post-transplant. That doesn't change. Being proactive in your recovery every day. Because even if you feel like you're in decline, you're actually in recovery. If you can stop the damn flood that is this rampant alcoholism that honestly wants to consume you, and it wants you dead. It is merciless. And you have to be brave. This is the fight of your life, and it is a very, very noble one. And if you can break through this and come out on the other side, you will have done something that very few people in the world are capable of doing, that will ever experience anything like this. So this advice applies to you whether you're hoping to be transplanted, whether you've been denied, whether you're hoping to be listed. It's that you have a very simple choice right now that will honestly, this truth, they say it all the time, but it's true. The truth will set you free. Be honest. Be honest with yourself, because you deserve that. And if you can be honest with yourself like that, without feeling sorry for yourself, without thinking you're a bad person, you might be able to look in the mirror and you might be able to say that you're worth it, that you're worth surviving.
It's really easy to overlook the caregivers in our patients' lives, but they have a story too.
Having my husband with alcohol abuse was really hard for us. It was for 30 years, and it was so hard for my kids, for my family, even for friends. We won't have friends come over because he will be drinking all the time, and I'd rather have no friends. But now I feel so proud of my husband because he's a new man and he's a completely new person. And he's the best for us. And I'm so blessed to have my husband. And I'm so happy and proud because he's still with us. And I want to say that UCLA has been so great for us. All the help, all the people that works with UCLA, it's been the best and it's been a blessing. And I'm so happy to have my husband. I told you I can't do this. I'm just so happy.
A lot of the suffering I endured witnessing his battle with addiction came from thinking that if I couldn't stop it, it meant that I wasn't loving him enough or capable of finding him the help that he so desperately needed. And it was through this incredible, beautiful gift and UCLA being our saving grace that it is so clear that it can't be for anyone else. It does have to be for yourself. It has to be for you. And it is about self-love without fear or judgment or shame. I know that if you're watching this, you're probably scared, and that's okay. You're in the right place. And wherever you are on your journey, it will start with what you decide to do today and every day moving forward, no matter what the outcome is. And just know that you're not alone and that there is hope. I found so much hope in other people in the transplant support group, and I hope that we can do that for others too. So as the caregiver, it is so important to take care of yourself too. And I will say, take care of yourself first when your loved one is in the hospital, whether they're waiting to be evaluated or listed, transplanted. You have to take care of yourself and make sure you're sleeping enough, that you're getting the nutrition you need, enough water, hydrating, because this is a very emotional roller coaster that you'll be on. And if you are running on empty, so to speak, you can burn out, and for your loved one, when they'll be counting on you for that support and that care, it is so important to also make sure you're okay. I would highly recommend therapy. I think that doing little things for yourself, whether it's exercise, and if you have to take a nap, if it's going for a walk, because this is an amazing, incredible journey that you'll be on, but you're not alone again. So reaching out to even your social worker, having other family and friends there to support you. Al-Anon, absolutely. And I think just, again, day at a time, because things might change very quickly from one day to the next, trying to just talk again and be open and communicating with someone, your loved one as well. But, depending on how sick they might be, you really have to make sure you're okay.
This is a very scary thing because there's a lot you're going to have to endure. You're going to have to endure all of these things, this pain, and you can't struggle against it. You can't make it go away. You can't wish for it. If you complain, it won't make any difference. You're going to have to endure this and be very, very honest with yourself. You don't even need to be honest with your family anymore. Just need to be honest with yourself. If you're watching this, then you have all the hope you're going to need. You're at UCLA and you are on their radar. And I didn't have that afforded to me to begin with, but I'm telling you, as soon as you get to UCLA, they will evaluate you fairly. They will take care of you. You will be okay if you do everything that they ask you to do. And when they ask you to do it, I'm asking you to do it this way. Don't do it reluctantly. Don't do it even with any thinking. Just do it.
If you're working towards getting listed or getting a transplant, what I suggest you to do is to do what the hospital says and to do what your programs say. Because for all these years you've been trying it your way and it hasn't worked. Even if you get rejected, you still have to follow the instructions because there's still survival out there and there's still hope. So if you follow the treatment and you follow what they say and what to do, that's the best thing you can do, because everything you've done in the past hasn't worked and it's obvious it's not going to work. So you have to stop doing that and do what the hospital says, what your doctors say, and what your therapist and your program says.